I've been involved in leading some of the escape sessions over the last few months for the group of patients that it involves. So kind of your arthritic hip and knees was the main group, and then we started the escape backs as well. I guess from a personal point of view, you just feel like you're giving them the best time and input that you can do. There are quite a lot of pressures sometimes working in an outpatient department, and you'd like to see people, weekly if you could, but unfortunately you can't a lot of the time. So you might see them 3, 4, 5 sessions over a couple of months, or maybe even longer, maybe every 2 weeks, 3 weeks, if that, and that'll be quite a good level of interaction for an outpatient department. So knowing that you can give them bi-weekly input, for the whole session, that's really useful, and it's an hour's time as well, which is double the time they get in an outpatient department. So from a time point of view, it's really nice to be able to know you're giving a lot. I suppose it's just a learning opportunity as well. So the people running Escape came in, gave us a chance to talk through some of the evidence behind managing arthritic hip and knees, and then also an opportunity again to practice running group sessions. You've got to be, you're not lecturing people aren't there just to hear you listen to them. So that kind of skill of managing a group is quite tricky. So it's quite nice to have an ability to practice and have either colleagues kind of discussing with you, whether that's physio colleagues or members of the Cardiff Vale University Health Board, or in the gyms themselves. So you can have a bit of a discussion together about how the sessions have gone. And it's nice to get some positive feedback, which we did at the end of every session. And I guess from a kind of a service point of view, these escape sessions useful for the outpatients department, because it's taken a fair chunk of patients that would have been on the waiting list for physio and probably taken quite a long time to go through the system. They just stayed within the physio department because they're lifelong conditions. It's not something that gets better. It's teaching people to manage them. So you often do see them for a long time. So that large group of people are now not being managed in an outpatient setting. They're getting managed in a community setting, which is much more beneficial long term as well, because you're hoping you're giving them the skills for them to manage on their own, and it's not something that they're going to be bouncing back to a physio department, which can happen when somebody goes in to see a physio and they do a few sessions and they get a bit better and they're really motivated, and then 6 months later they've forgotten what they were doing, or they don't have access to the gym equipment you were doing in sessions with them. Whereas in the community, if you get them involved in a gym setting and then they're joining, and then as soon as they finish, they're hopefully carrying on and they've got a plan, hopefully it'll be, I suppose, less of a burden to the NHS system as well, because you've got people managing their condition. I guess from a escape program point of view, it's been good because you're giving standardized high level care,